Hello, Ole Miss, and welcome back to the SIP. As usual, I am Lucas Sweeney, and today marks episode 2 of our mini-series about the student health here on campus. Today, we are joined again with Alex Langhart, who is the Director of University Health Services. And today, he's going to be telling us a little bit about insurance and healthcare. Alex, thank you so much for joining us again. How you doing?
Yeah, glad to be back. Doing pretty good.
All right, well, we're just going to jump right into our first question. Could you just tell us, what is health insurance and why do we have it?
So think of health insurance like a safety net. Like you purchase car insurance, you want to have something to back up in case of a catastrophic coverage. So health insurance kicks in to help cover those expensive doctor's visits, hospital visits, ambulance, and even air evacuation as well. So because healthcare is so expensive in the United States, you need insurance in order to cover those high costs.
All right, well, oftentimes college students on their parents' health insurance. So how do they get set up at places like the Student Health Center, but even places like pharmacies and urgent or 24-hour care facilities?
Yes, it's awesome that students continue to be on their parents' health insurance up until age 26. But really, any healthcare facility you go to, they're going to ask for the copy of your insurance card. So it's always smart to bring that with you, have a copy, whether it's the physical card. Now at Student Health, you don't have to have the physical copy. I actually encourage parents to tell their students, just take a picture of the card. That's all we need. Show it to us, we'll put it in the system, and then you're good. And really, you only need to update the facility whenever your card changes or you have new coverage.
And then Alex, what are some of the general overall benefits that health insurance provides, and what are some of the tips students should know to be empowered when they're seeking care with their health insurance?
It's a great question. So healthcare insurance benefits. First, cost savings. You know, healthcare is very expensive in the United States, so anything that can help cover that exorbitant cost is great. Now sometimes you're going to have to pay a deductible, a copay, or something else out of pocket, but the majority of your costs should be covered by insurance. Next is going to be preventive care services. So a lot of people forget that if you're in network at a certain provider, they're going to cover that annual visit for free, kind of like a physical. And that's important to know where your health stands so that you can get in front of any type of chronic conditions or other acute conditions that may come up. So it's like getting that annual tune-up like you do for your car. And then lastly, just peace of mind. So I know we talked about cost earlier, but there really is a peace of mind in knowing if something catastrophic happens, if the worst thing happens, that you're not going to be on the hook for even hundreds of thousands of dollars in healthcare expenses, at a hospital or an ER. So all of those things, I think, are benefits of health insurance. Now, for students to empower them to use their health insurance, I think, one, you need to know your plan. Know the ins and outs of it. Read the fine details, because not all plans have copay, deductible, or co-insurance, or they might have a high deductible with no copay. So you need to know, one, what those terms are, so healthcare literacy is important, but also how that applies to you when you go to certain providers. Second part is in-network providers. So if you go to a clinic that you're unsure of, you might be considered out of network, and that means you would have to pay the full cost of whatever they charge. See, when you have insurance, they make contracts with these providers to say this is how much we're going to pay. So you're protected at an in-network provider. So make sure that you're choosing in-network providers. Now, with new laws that have passed, they have to give you a good faith estimate if you don't have insurance. So you kind of have an idea of cost going into it, but it's still important to check that out before you go. And then lastly, I think you should take advantage of the Student Health Center because we don't have office visit fees. We don't require copays, so we really take away that financial barrier for our students, which is always a concern. You know, anything that we do nowadays, we're thinking, what's the price on it before we go take care of ourselves?
Definitely, definitely. And what are some of the specific benefits that students have here on campus? And can students get health insurance through the University of Mississippi should they not be on their own plan?
Great question. So specific benefits for student health, like I said, is that we have no office visit fee. So that $70, $80, $90, $100 charge just to see a provider is waived. So no copay. The only thing we're billing are ancillary services, which are lab, x-ray, supplies, injections, those types of things. But we make a conscious effort to keep all those costs very low for our students. And thanks to the Family Leadership Council, we now have a medical expense fund. So students without insurance or that have something that's out of network like Medicaid, Medicare, they can apply for that and their visit will be covered through that generous fund. So that's awesome. And what was the second part of your question?
Can students get health insurance through the university?
Yes, that is actually a new offering. It used to only be available to graduate assistants and international students, but now there is a plan offering that IHL has mandated for all universities. So we offer United Healthcare, and you can check that out on our website at healthcenter.olemiss.edu, and click on our insurance tab, and it'll tell you all the ins and outs of the plan. Basically, everything's covered at 100% when you come see us through that plan, so you save a ton of money on that, and the deductible outside of that for other clinics is only $250, so I think it's a really good deal.
Yeah, you guys got to be taking advantage of these things, got to. Well, that's all the questions I have for you. Is there anything else you want to add before we sign off?
No, just come check us out. I know that it's hard to navigate, especially for freshmen, your first couple of weeks here, but we're a great resource, and even if you just want to have a conversation, just make an appointment. Again, there's no office visit fee, so that's a free visit just to talk with a physician or provider, and we're so happy to serve you.
All right, well, Alex, once again, thank you so much for joining us. And you guys at home, do not forget to like, comment, and subscribe if you want to stay up to date with all the new episodes of The SIP. And do not forget to stay tuned for the next episode, episode 3 of the Student Health series, where we are going to be talking about the pharmacy that is inside of the Student Health Center. We'll catch you guys on the next one. Peace.